Welcome to the Baby Master PT Q&A. My name is Cherrick Gordon. I've been a pediatric physical therapist for over 25 years. And today I'm answering a question that came into me from one of my subscribers. So I'm going to answer the question and then we're going to do some demonstration as to how this parent can help their little one at home. So here's the question. Thanks, this was very useful. My daughter is 12 months old and can't sit independently either. The specific question I have is regarding her neck. She tends to hold her neck in hyperextension and seems to use an extensor pattern back arching for stability when sitting. She struggles to maintain a neutral head position consistently and appears to compensate for poor trunk control by extending backwards through the neck and upper back. I would appreciate advice on exercises/positioning to improve trunk activation and head control, specifically to stop hyperextension of the neck. Thanks. That's a very specific and well laid out question, and I appreciate that. And the first thing I want to say is this sounds fairly serious, like something that's just beyond the scope of just normal natural development. And I would recommend, as a matter of fact, I would strongly recommend that you speak to your pediatrician, get a physical therapy evaluation so that someone can come and actually lay their hands on your baby. Having said that, here are a couple of things that I'm going to show you that you can actually try at home. We're going to use my doll here as an example. Now, what this parent is describing, talking about the neck moving into hyperextension, it just means that, for instance, if the baby is sitting like the baby is sitting now, you know, the way this baby is kind of flopped forward, but instead the baby in question has her neck kind of back like this, and baby would tend to fall backwards. So there are a couple of things that one can start doing. If your baby is not able to maintain their balance in the seated position, then you want to start off by being able to get baby to hold their head up steady and solid in a neutral position. Now, by having hyperextension, it means that baby neck is kind of like this, backwards a lot when baby is sitting. This is automatically pulling baby backwards into this position. Now, this means a couple of different things. One, the neck extensor muscles, these muscles in the back of your baby's neck, are pulling your baby backwards. This leads to a couple of different conditions happening at the same time. One, these muscles in the back of your baby's neck become shortened or tighter as baby continues to hold her head in this type of position. But it also means that simultaneously, the neck muscles on the front of baby's neck are also becoming a little bit more stretched out or elongated to where these muscles on the front of baby's neck are a little bit longer than you would ordinarily want them to be. So there's this imbalance between the flexor movement of your baby's neck and the extensor movement of your baby's neck. And so there are a couple of different things we can start doing to help baby to round out the control of her neck. The first exercise I'm going to show you is more of a head sit up rather than anything else. So if you position your baby facing you, hold baby make your arms nice and big, hold baby's shoulders in, let the neck go back, which it will naturally do. Lean baby backwards a little bit like this, but cue baby to lift her head like that, where baby is just doing a small sit up with just baby's head, where she's just bringing her head, letting her head go back down and bringing it back up. Now, baby who has extensor muscle tone, when you put your baby in this position and she leans backward, it may be quite challenging for baby to now bring her head back up and do the actual sit up that you're trying to get her to do. But try it and see how it works and let me know. The next activity that you can do is some side exercises. And this is going to work really well for this baby because now we're trying to take baby out of the pattern the baby has of sitting, where she hyperextends her neck and arches her upper back backwards, which is actually pulling her to fall onto her back. And so if you get down on the ground with your baby, this is going to take a little bit more of involved work. But if you put your baby inside lying and cue baby to lift her head up like this, there are these two really big muscles running along the sides of your baby's neck. These muscles are called the sternocleidomastoid muscles. They're this big muscle on the side, on either side of your baby's neck. And they do the side bending, but they also do the rotation of your baby's neck to either side. They side bend to one side and rotate in the opposite direction. So the way you would do this side bending activity, if you use a cushion like this, if you take baby, put baby to lie on her side on the cushion, take your hand, put your hand on baby's shoulder and hold baby's shoulder, it will make this muscle here elongated and cue baby to just lift her head up in this direction. So now what you can do, the way to do this so that it's not this challenging, super challenging activity, will be to actually get down on the ground at eye level with your baby, face to face with your baby, and show baby as you're doing it, baby is imitating you and baby can do it. And eventually baby will get the idea and be able to start lifting the head and straightening her head up to make eye contact with you. Now, keep in mind, the first time that you do this, it may not work, simply because baby might not understand exactly what it is, which is why I want you down here doing the modeling. You're going to put your head down like baby, make eye contact, say her name, talk to her, and then you're going to lift your head up and do peekaboo, and baby is going to try to lift her head up to do the peekaboo. As always, what you do on one side, you want to do on the other side. So you're going to switch baby, and you're going to switch as well to where you are on your other side, and put baby on her side. So lay gently on her side. Put your hands on baby's shoulder. Once you stabilize the shoulder, now you're positioning baby in a way where gravity is acting on baby's head to pull it down this way, and you are cueing baby by giving baby this counter force with your hand on baby's shoulder. This will allow baby to bring the neck up like this. As you continue to practice these activities, you'll notice baby's head will start to be a little bit more stable. But now continue working on the front neck muscles. And what you can also do is, hang on 1 second, outside, and get my ball, get my exercise ball. Well, if you take your baby, if you have an exercise ball, if you don't have an exercise ball, I would suggest getting one. It's a really great surface for working on with your baby in all kinds of different planes. And what it will allow you to do is be able to put your baby on the ball, put your baby, let me see what that looks like. Okay, so here's what we're going to do. Let me come down on the ground here. If you put your baby on the ball, and this baby, like we established, has extensor tone, so her head is going to tend to want to go backwards onto the ball. But if you slide the ball forward and you bring baby's hips down, put your hands together, put your thumbs on baby's tummy, so that your hands are pushing down on baby's hips, and bring baby all the way down. You want to cue baby to do a tiny baby, almost like a head sit up with baby. You bring baby's head up, boom, like that, and cue baby to bring her head up. Now, as you continue to do these, I want you to add a little variation. Roll baby slightly onto her side and cue her to lift that head up. And then roll baby to the other side, cue baby to lift her head up. The movement of the ball under your baby will also stimulate your baby's vestibular system and have some nice calming effects to tend to reduce some of that spasticity and muscle tightness that you're talking about in baby's neck. So again, cue baby to bring that head up. You can take your finger and tickle baby's neck. You want to activate those front neck muscles and help baby to start being able to flex her muscle, flex her neck, and bring her neck up. All right, my friends, that is it for today's live Baby Master PT Q&A. As always, my name is Cherrick Gordon, and don't forget to hug your babies, and I will see you in the next video. Take care. Bye-bye.